I am Dr. Santosh Prabhu, the Chief Neurosurgeon and Director of Neurosurgery at WINS Hospital, Kolhapur. Today I am going to talk to you about a potentially life-threatening condition which may occur in the brain and a condition whose treatment, if diagnosed correctly, can be satisfactorily done. This is called as a brain aneurysm. Now, what is a brain aneurysm? A brain aneurysm is a balloon which forms on the main blood vessels which supply the brain. So, these aneurysms are typically seen in people who are between 35 to 65 years old. It is commoner in people who have high blood pressure. It often runs in families. If there is a family member who has an aneurysm, there are several fold chances that you also have an aneurysm in the brain and you should get yourself screened for it. It is commoner in women, especially the elder women, because once the women reach menopause, their estrogen levels go down and the chances of developing and rupturing an aneurysm increase substantially. So, if you have an aneurysm, what can it do to you? It can rupture, it can burst and produce a devastating bleeding in your brain. And this bleeding in the brain can do damage to the brain in several forms. Now, what are the causes of bursting of this aneurysm? If your blood pressure is uncontrolled, an aneurysm which is present may burst. If you do unusual exercise, if you lose your temper and just go, you have a rage phenomena, then the blood pressure in your brain will rise and the aneurysm will rupture. It can also rupture during sexual activity. These are the common conditions which cause an aneurysm to rupture. Another cause is if you are constipated and you are straining to pass stools, then this also can cause a rise in the pressure and cause the aneurysm to rupture. So, what are the symptoms of an aneurysm? The aneurysm symptoms can be divided into three. The first category is aneurysm which has not yet ruptured. What will be the symptoms of such an aneurysm? A patient with an aneurysm which is not bled will cause him minor and frequent headaches, which will just not go away with routine medications. It may produce an occasional vomiting in you. It may produce decreased vision in one eye. It may produce giddiness. It may cause double vision. So these are the symptoms that an unruptured aneurysm causes. But if the aneurysm ruptures, then everything changes. Now the symptoms become very dramatic and the patient gets a severe headache, what he describes as the worst headache of his lifetime. Tremendous headache will occur associated with neck pain, associated with continuous vomiting. The patient will start looking very sick. He won't be able to move his neck forwards and backwards and side to side. The patient may get decrease in vision. Patient may get seizures, fits. The patient may have double vision. He may have difficulty in walking. He may start losing power in one limb. He may develop a slurred speech, and finally his level of consciousness will start decreasing. The patient will become drowsier and drowsier and may lapse into coma. A ruptured aneurysm is a fatal condition, and almost 40 to 45% of people who rupture their aneurysms die. So it is very necessary to treat this condition quickly and at a well equipped center. The third category of symptomatology which arises is if you have an aneurysm which is about to rupture and it is leaking small amounts of blood. Such a leaky aneurysm will produce headaches, vomiting, which will then pass away. You will feel better. Again you will have a headache, again you will have vomiting, again you will feel better. You may get blurring of vision, you may get giddiness, you may have double vision. If any of these symptoms are observed in any of you or your near and dear ones, you need to consult an expert neurosurgeon immediately without wasting any time. Now, once an aneurysm ruptures, there are three swords like the Damocles swords which start hanging on the neck of the patient with a thin thread. What are these three swords? The first one is called as rebleeding. That means the ruptured aneurysm is sealed by the body by a thin clot which is formed on that hole. This clot is like a cork which may just fly off if you have a bout of coughing or if you have constipation and you strain at stools. Suddenly this clot can get dislodged and the aneurysm will bleed again. This is called as rebleeding. Rebleeding has a mortality of 90%. So almost nobody with a second bleeding survives. So the second complication or problem that may arise following a rupturing of an aneurysm is called as vasospasm. What is vasospasm? As the name indicates, it causes constriction of the blood vessels in the brain. What happens is the blood that leaks out when the aneurysm ruptures spreads in the brain and it undergoes a process of chemical breakdown which produces certain harmful chemicals in the brain which act on the blood vessels to cause their constriction. This is called as vasospasm or vasospasm, and it typically starts on the fourth day of the bleeding and continues for about 14 to 15 days. We are using medications to prevent this vasospasm, but still sometimes the vasospasm itself can increase and become a life-threatening condition. For such vasospasms, we have to then perform what is called as a chemical angioplasty, where we insert a catheter into that blood vessel and inject certain drugs to open up the vessels which have gone into spasm. The third sword, as I told you earlier, which is hanging on this patient's neck is called as hydrocephalus. Hydros means water and cephalus means head. So increase in the amount of water inside the head is called as hydrocephalus. How does this occur? The blood which has come out again goes and clogs the pathways of flow of CSF in the brain, the water in the brain, and this causes the water to accumulate and gradually the water level rises and so does the pressure. So we may have to insert a tube in the brain temporarily or permanently to handle this situation. So now you have gone to a doctor who has examined you, who suspects that you have an aneurysm. How is the diagnosis made? Clinically, the neurosurgeon will examine you and he will look at your neck movements, and if you have what is called as neck stiffness, then the chances of your having ruptured an aneurysm and produced a subarachnoid hemorrhage is very high. Next thing he will ask for is a CT scan. This CT scan, if you have had a bleeding of your aneurysm, is almost 100% accurate in diagnosing the bleeds, thereby causing a suspicion, a very high index of suspicion of aneurysm. The location of this bleeding can give the neurosurgeon a clue as to which blood vessel has the aneurysm. The next test that he will perform is an MRI with an MR angiogram. These two tests, with a fair amount of certainty, with a 95% accuracy, will show the aneurysm and show the size, the location of the aneurysm, and whether there is hydrocephalus or not. Then the neurosurgeon will ask for a CT angiogram, where a radio opaque dye is injected inside the body and special rapid CT scan is done. In this, 99% of the aneurysms will be seen, and the information that is obtained from this is often sufficient to perform surgery using 3D reconstruction of this data. The last word in diagnosis of an aneurysm is a test called as cerebral angiography or digital subtraction angiography, or a DSA of the brain, which will in 100% of the cases show the aneurysm. Now the aneurysm is diagnosed and an immediate treatment needs to be done in order to occlude this aneurysm or to exclude it from the general circulation. How is this performed? There are two ways of doing it. First is called as surgery, or the surgery is called clipping of the aneurysm. This is, in expert hands, a very good modality to treat aneurysms, where the surgeon performs a small operation the size of a 1 rupee coin and goes to the neck of the aneurysm and puts a titanium clip on its neck, thereby occluding it and excluding it from the general circulation. The other modality is called as endovascular treatment or interventional treatment, in which a catheter is passed from the groin into the blood vessel on which the aneurysm has arisen, and fine coils are inserted inside the aneurysm. Platinum coils, which are very small, are inserted to pack the aneurysm from inside with these coils. This is also a good treatment. A third treatment, which is often done for very difficult aneurysms, which can neither be operated nor be coiled, is called as a flow diverter insertion, where a specially devised stent is placed across the neck of the aneurysm to, as the name indicates, divert the flow from the aneurysm into the circulation ahead. So my dear friends, this is how an aneurysm is diagnosed and treated. Now there are some very important things that one must remember while selecting a proper center. Simply clipping or coiling the aneurysm and excluding it from the circulation is not the end of the aneurysm problems, because vasospasm, hydrocephalus, these continue to occur even after the aneurysm has been occluded, and excellent ICU care needs to be given to these patients for almost a period of 15 days to bring this patient out of this storm in his brain called as a ruptured aneurysm. There are certain lifestyle changes which need to be done to prevent an aneurysm from happening, as well as to prevent an aneurysm from rupturing. And what are these lifestyle changes? First is your blood pressure must be properly controlled. If you have a high blood pressure, the aneurysm will form, it will increase rapidly and definitely lead to a rupture. So controlling your blood pressure is a very, very important part of lifestyle changes that you need to take to save yourself from aneurysm and its disasters. You need to again control your diet well so that you have a simple balanced diet. Avoid excessive non-vegetarian, especially red meat. Avoid fatty foods, avoid sweets, have fruits, plenty of green leafy vegetables, full cereals in your meal. Generally have a healthy meal and stay healthy. Exercise should be done in moderation and never in excess. If you do excessive exercise, the blood pressure shoots up too much and the aneurysms can enlarge and rupture as a result of this. So, my dear friends, I have told you about this devastating and life-threatening condition called cerebral aneurysms, and I have also told you how to deal with it. Thank you for being here and listening to me patiently.